Good afternoon, and thank you for joining us for today's webinar, When Hate Hits Home, Understanding Californians' Experiences with Acts of Hate. My name is Todd Hughes. I'm the director of the California Health Interview Survey, which most of you know as CHIS, here at the UCLA Center for Health Policy Research. As a land-grant institution, we would like to begin by acknowledging the Gabrielino Tongva peoples as the traditional land caretakers of Tovaangar, that is the Los Angeles Basin and South Channel Islands. If this is your first time attending one of our webinars, welcome. To those of you who have joined us before, we appreciate your continued support. Today we'll be presenting two new studies that examine hate acts in California and the many ways they affect the people who experience them. In 2024, approximately 3.1 million Californians 12 and older directly experienced a hate act in the previous year, according to the newest California Health Interview Survey data that we released in a fact sheet in October. Today's first study is a policy brief that examines the number of hate incidents people experienced, the types of resources they needed, and whether they were able to access them. The second is a qualitative study that catalogs people's personal experiences, detailing how their lives were affected. Together, these two studies work in concert, demonstrating the capability of the CHIS program to combine quantitative and qualitative studies, in this case, combining the rigorous CHIS data and in-depth in-person conversations with study participants to illustrate the human toll that acts of hate take on people. This work began in earnest in 2023 when the California Civil Rights Department began sponsoring questions that were added to the annual California Health Interview Survey. Leveraging the reach of the largest population representative state health survey in the United States would help the Civil Rights Department, as well as researchers, advocates, health professionals, and others, gain a clearer understanding of the overall impact of hate acts across California. We express our appreciation to the Civil Rights Department for supporting this important work. Today's first speaker will be Dr. Alex Bates, a senior data analyst from the California Health Interview Survey and lead author of the policy brief. Dr. Bates will share with us how people's experiences with hate acts and access to support and resources compared across demographic groups, disability status, sexual orientation and gender identity, and among different regions in California. Next, we'll hear from Dr. Valerie Steinmetz, Program Director at the Public Health Institute and one of the authors of the qualitative report. Dr. Steinmetz will present some of the anecdotes that victims of hate acts shared, which includes some of the reasons they didn't receive support and how their experiences affected their mental and physical health, day-to-day behaviors, and even their personal finances. Before we begin, I want to define what we mean by the term hate acts, so we're all working from the same understanding. Hate acts include both hate crimes and non-criminal incidents motivated by bias against people based on their identities, characteristics, or beliefs. Hate acts include physical violence, verbal abuse, cyberbullying, property damage, and other types of incidents, such as emotional abuse. As a reminder, today's webinar is being recorded and will be posted to our YouTube channel in the coming weeks. If you would like a copy of today's slides, please email our communications department at healthpolicy@ucla.edu. Alex, take it away.
Thank you, Todd, for that great introduction. If you go to the next slide, please. Good afternoon, everyone. Before diving into these findings, I just want to briefly go over a few key points here. First, as Todd mentioned, acts of hate were pervasive in 2024. Approximately 1 in every 11 Californians 12 and older, or 3.1 million people, directly experienced acts of hate in the past year. In 2024, the California Civil Rights Department partnered with CHIS to begin measuring both the number of hate acts people experienced and their access to support afterwards. This presentation and the accompanying policy brief present estimates from the 2024 CHIS on the frequency of hate experienced in the past year, the common types of support received by victims of hate, and the common unmet support needs. Results are shown by region and respondent characteristics. 3 final points before we jump into the data. First, all estimates are based on a person's experiences in the past 12 months. Since CHIS 2024 was administered throughout the year, the past year can mean any time between early 2023 and late 2024, depending on when the person was surveyed. Second, whether an event counted as a hate act depended on the person's perception that they were targeted because of their identity, characteristics, or beliefs. Finally, supports received or not received after experiencing hate was based on the most severe act if the respondent had experienced multiple in the past year. Next slide, please. Thank you. Statewide, Californians who experienced hate faced an average of 5.6 acts per person over the past year. With roughly 3.1 million Californians 12 and older experiencing hate, this corresponds to more than 17 million hate acts experienced in the past 12 months. Notably, 1 in 5, or 20%, of those who experienced hate faced 6 or more acts of hate in the past year. Now on to the regional estimates shown here. CHIS groups California counties into 7 geographic regions to allow for more meaningful analyses. You can find more information about which counties make up each of these regions in the Ask CHIS dashboard online. Among Californians who experienced hate in the past year, the average number of acts per person was 11.6 for those in Northern and Sierra counties, 7 in the Central Coast, 6.1 in the Sacramento area, 5.7 in San Joaquin Valley, 5.6 in other Southern California counties, 5.3 in the Greater Bay Area, and the lowest was 4.2 hate acts in Los Angeles County. Northern and Sierra counties had a significantly higher average than the statewide rate of 5.6, and Los Angeles County was significantly lower. No other regions differed significantly from the statewide average. Next slide, please. Moving on to the types of support or help received after experiencing an act of hate or after the most severe incident if they had faced multiple. Overall, 60% of those who experienced hate said they had received no help or support afterwards. 20% received counseling, therapy, or another type of mental health support, and this was the most common type of support received. 8% received time off work, 7% received help reporting to or working with police, 6% received time off from school, 5% received support from their family, friends, or community, and 5% also received protection for their physical safety. Overall, approximately 14% of hate victims received more than one type of support after their hate experience. Next slide, please. Thank you. Now let's look at how receiving mental health support varied across different populations in California. 21% of US-born respondents received mental health support after their experience with hate, significantly more than the 15% of those born outside the US. 25% of female respondents received this support, significantly more than 13% of male respondents who indicated they had. 33% of sexually diverse, that is, non-heterosexual respondents received mental health support, significantly more than the 16% of heterosexual respondents. 28% of adults with a disability received this support, significantly more than the 13% of adults without a disability. And although 25% of adults with unstable housing reported receiving mental health support compared to the 16% of adults with stable housing, this difference was not statistically significant. Every population group shown on this slide, except US-born respondents and adults with unstable housing, differed significantly from the statewide average of 20%. Next slide, please. Thank you. Now let's move on to how mental health support varied across different racial and ethnic groups in California. 25% of Black or African American respondents received mental health support after their experience with hate. This was followed by 25% of American Indian or Alaska Native respondents, 23% of multiracial respondents, 22% of white respondents received mental health support, significantly more than the 17% of non-white respondents. 20% of Latinx respondents received the support. 12% of Asian respondents received mental health support, significantly fewer than the 22% of non-Asian respondents who indicated they had. 11% of Middle Eastern or North African respondents received mental health support, although this estimate was unstable. And 7% of Native Hawaiian or Pacific Islander respondents received this type of support, significantly fewer than the 20% of those who did not identify as such, although this estimate was also statistically unstable. Across all racial and ethnic groups in California, only rates for Asian and Native Hawaiian or Pacific Islanders differed significantly from the statewide average of 20%. Next slide, please. Thank you. Now let's zoom back down and look at regional differences for rates of receiving mental health and multiple forms of support after the respondents experienced hate. 12% of Californians living in Northern and Sierra counties received mental health support after their experiences with hate. This was significantly lower than the statewide average of 20%. 19% of Californians in the Greater Bay Area received mental health support, 15% in the Sacramento area, 23% in San Joaquin Valley, 16% in the Central Coast, although this estimate was unstable, 20% in Los Angeles County, and 21% in other Southern California counties cited receiving mental health support. Moving on to receiving multiple forms of support. Only 6% of residents in northern Sierra counties who had experienced hate received multiple forms of support afterwards. Similar to mental health support, this was significantly lower than the statewide average of 14%. 13% of Californians in the Greater Bay Area received multiple forms of support, 12% in the Sacramento area, 18% in San Joaquin Valley, 9% in the Central Coast, but again, this was an unstable estimate, 12% in Los Angeles County, and 16% in other Southern California counties reported receiving multiple forms of support after their experiences with hate. Besides Northern and Sierra counties, no other regions differed significantly from the statewide averages for receiving mental health support or multiple forms of support. Next slide, please. Thank you. We'll now look at unmet support needs for victims of hate. Overall, 31% of Californians who experienced hate stated they needed help or support but did not receive it after their encounters with hate. This slide highlights the groups where rates of unmet support needs were significantly different from their comparison group. Starting with the racial and ethnic groups, 44% of American Indian or Alaska Native Californians reported having any unmet support needs. This was significantly higher than both the 29% of those who did not identify as such and the statewide average of 31%. 20% of Californians reported having any unmet needs, significantly lower than both the 34% of non-Asian Californians and the statewide rate. 42% of Black or African American Californians had unmet needs, significantly higher than both the 29% of non-Black or African American Californians as well as the statewide average. And 35% of Latinx Californians had any unmet support needs, significantly more than the 29% of non-Latinx Californians. Turning to other respondent characteristics, 41% of adults with a disability reported having any unmet support needs. This is significantly higher than both the 25% of those without a disability and the statewide average of 31%. In contrast, those without a disability were significantly less likely to report unmet needs compared to the statewide average. 37% of female Californians had unmet support needs, significantly higher than both the 25% of male Californians and the statewide rate. Conversely, male Californians had rates of unmet needs significantly lower than the statewide average. Half of adults with unstable housing reported having any unmet support needs after their experience with hate, significantly more than both the 27% of those with stable housing and the overall statewide rate. We also looked at differences across different types of areas where Californians live. Urban areas are the most densely populated areas. Mixed urban areas have moderate population density, and suburban areas are moderate population density areas that are outside the urban core. 46% of those living in mixed urban areas reported having any unmet support needs after experiencing hate, significantly more than the 29% in urban and suburban areas. Those living in mixed urban areas were also significantly more likely to report any unmet support needs compared to the statewide average of 31%. Next slide, please. Among the 31% of Californians who experienced hate that also reported having any unmet support needs, the most common type of unmet support was mental health support, with 38% indicating this was something they needed but did not receive after their experiences with hate. 23% reported unmet needs for physical protection for themselves. 22% cited unmet needs for help reporting to or working with police. 21% had unmet legal assistance needs. 18% had unmet financial assistance needs. 14% reported unmet support regarding receiving time off from work. And 9% reported unmet accountability or validation needs, which, for example, might be not receiving acknowledgement of the problem from their family or friends. Notably, 38% of those who had any unmet needs reported having multiple types of unmet needs. For example, not receiving needed mental health support in addition to legal assistance. Next slide, please. We'll now look at how rates of multiple unmet support needs varied across different populations to see which groups were most likely to face multiple barriers when trying to get needed support after experiencing hate. 59% of Asian Californians who experienced hate and reported having any unmet support needs had multiple types of unmet needs, This was significantly higher than the 34% of non-Asian respondents and the statewide average of 38%. 45% of non-white Californians had multiple unmet needs, significantly more than 33% of white Californians, though not significantly different from the statewide rate. 65% of non-US citizens cited multiple unmet support needs, significantly more than the 33% of US citizens and the statewide average of 38%. Similarly, 51% of those who were born outside the US had multiple unmet needs, again significantly higher than both the 33% of those born in the US and the statewide average. And 49% of Californians who spoke a non-English language at home had multiple unmet support needs, significantly more than the 29% of those who spoke only English at home. Rates among those who spoke a non-English language at home were significantly higher than the statewide average, while rates among English-only speakers were significantly lower than the statewide average. 56% of adults with unstable housing cited multiple unmet support needs, significantly higher than both the 41% with stable housing and the statewide rate of 38%. 53% of Californians who lived in mixed urban areas had multiple unmet support needs, significantly more than the 29% of those living in the lowest population density rural areas, but not significantly different from the statewide average. Finally, 50% of adults with a disability reported having multiple unmet support needs, significantly higher than the statewide average, but they did not differ significantly from the 40% of those without a disability who reported multiple unmet support needs. Next slide, please. Thank you. So now look at whether there were any differences between the regional and statewide rates across the different types of unmet support needs that CHIS measured. Starting with the most common type of unmet support, mental health support. 45% of Californians living in northern Sierra counties who reported having experienced hate in the past year and had any unmet support needs cited mental health support as an unmet need. 43% in the Greater Bay Area indicated the same, 39% in the Sacramento area, 24% in San Joaquin Valley, 40% in the Central Coast, and 41% in Los Angeles County, and 34% of those living in other Southern California counties had unmet needs related to mental health support. Estimates for the Sacramento area, San Joaquin Valley, and Central Coast were each statistically unstable. No regions differed significantly from the statewide average of having unmet needs related to mental health support, which was 38%. However, there were three regional findings that were significantly different from the statewide average for that type of unmet need. Although each of these regional estimates were statistically unstable, so these findings should be interpreted with some caution. First, 5% of those living in the Central Coast who reported any unmet needs had unmet financial assistance needs, significantly lower than the 18% statewide who reported the same. Second, 3% of those living in the Sacramento area had unmet needs related to receiving time off work, significantly lower than the overall statewide rate of 14%. Finally, only 1% of those living in Los Angeles County who reported having any unmet needs had unmet accountability or validation needs, significantly lower than the 9% statewide who reported the same. Next slide, please. Thank you. We just covered a lot of findings here, so you really might be asking yourself, what are some of the key takeaways from this presentation and the policy brief? Well, first, the 2024 CHIS data shows that Californians who experienced hate faced an average of 5.6 acts of hate per person over the past year. With approximately 3.1 million Californians 12 and older experiencing hate, this means that there were over 17 million hate acts experienced in the past 12 months. Additionally, 1 in 5, or 20%, of Californians who experienced hate in the past year faced 6 or more acts of hate. Despite this alarmingly high number of hate acts, only 40% of those who experienced any hate received support after the hate act, or the most severe act if they had encountered multiple. 20% of those who experienced hate received mental health support, the most common type of support received. Finally, unmet support needs were a noticeable issue among those who experienced acts of hate in the past year. Approximately 1/3, or 31%, of those who experienced hate indicated not receiving needed help or support afterwards. The most common type of unmet need was mental health support at 38%. However, 38% also reported having multiple types of unmet support needs. Next slide, please. Thank you. Reducing the impact of hate in California requires multi-pronged strategies to ensure communities and regions which are disproportionately impacted by hate have access to support they need. Here are just a few recommendations based on the 2024 CHIS data. First, it's essential that we sustain and expand population representative measurement of the frequency of hate acts and support needs in California. Ongoing data collection is critical to accurately capture the scope of hate acts and unmet support needs across different populations and regions in California. Second, the 2024 CHIS data shows that Californians who belong to communities that have been historically burdened by hate remain disproportionately impacted by hate and are more likely to report having any unmet support needs. To address these inequities, it's critical that there is expanded and sustained support for victim services that are tailored to the specific needs of these communities and of different locales across California. Some populations that are disproportionately impacted by hate do not trust or feel safe reporting and seeking help from formal agencies. Given the historical and ongoing trauma many communities have experienced through encounters with law enforcement and government agencies, community-based and localized resources for reporting acts of hate and receiving victim support afterwards should be supported. Finally, there needs to be ongoing support for the development and evaluation of local, community-specific, and evidence-based approaches to address hate and provide victim support afterwards. These approaches should be developed utilizing cross-sector and interdisciplinary coalitions and should be tailored to the specific regions and populations they intend to help. Furthermore, since more than 1 in 7 Californians 12 and older, or 4.8 million people, witnessed an act of hate in the past year, strategies to support witnesses of hate should also be developed and evaluated. Thank you for listening, and now I'm going to turn over to Val, who will talk to you about the qualitative study.
Thanks, Alex. All right, so today I want to talk about the findings from our qualitative study with CHIS survey respondents and their experiences and impacts from hate acts. So echoing what Todd said earlier, for the purposes of this study, hate acts are considered hostile expressions or actions committed in whole or in part because of a person's actual or perceived identities or characteristics. This can include race, color, disability, religion, national origin, sexual orientation, gender or gender identity, and or because that person is part of a protected group. Hate acts can include hate crimes and non-criminal hate incidents. And hate acts can consist of a range of actions. This can include slurs, hate speech, property damage, physical assault, as well as threats and intimidation, both online and offline. The project goal was to better understand experiences of Californians affected by hate acts, including descriptions of what happened, their reactions to and feelings about the act during and immediately after the act. We also looked at longer-term impacts and supports needed and accessed. Additionally, respondents were asked about financial costs incurred due to the hate act and whether or not they reported the hate act to authorities or discussed the hate act with others. Our methods were we conducted qualitative interviews with adults 18 and older who completed the CHIS adult questionnaire and answered yes to experiencing a hate incident in the past 12 months. A semi-structured discussion guide was developed and used by the project team. Our interviews were completed using Zoom. The interviews were offered in the 6 languages that CHIS is offered in. And our transcripts, they were generated, we reviewed them, and de-identified them. We took a descriptive explanatory approach to the analysis using a mix of inductive and deductive coding. And then we conducted a thematic analysis specifically exploring the longer-term impacts, the costs, and reporting of the hate acts. And we'll review those themes shortly. We had 53 adults who experienced a hate act in the past 12 months that were interviewed. In terms of the interview language distribution, we had 8 who completed the interview in Spanish, 1 completed it in Mandarin, and the rest, 44, were in English. Most of our respondents were female. 36% identified as Latin, and 32% were between the ages of 30 and 49. Respondents described the hate acts or the offender actions. You can see this included verbal abuse, cyberbullying, property damage, physical altercations, threats, and general harassment. Over three-quarters of our respondents described the offender actions as verbal abuse, followed by 21% that described physical attacks. And you can see these were not mutually exclusive. Respondents were asked what they thought motivated the offender in these hate acts they described, and they cited race most frequently. This was followed by ancestry, national origin or language, and then religion. Their other reasons mentioned included immigration, gender or gender identity, sexual orientation, as well as age, disability, and economic status. In terms of the relationship of the offender to the respondent, most respondents said the offender was a stranger or someone they only knew by sight. We did have many respondents, though, describe the offender as someone known to them, and this most commonly was a neighbor, landlord, or roommate. In terms of types of hate acts, we saw half of the acts were what we're considering these single hate acts, an impactful hate act unrelated to any other hate acts the respondent may have experiences, while the other half were described as ongoing or multiple related hate acts by the same offender. We saw the broader social and political context was an important factor in how some respondents thought about hate and why it occurs. They saw the political and social climate as catalyzing acts of hate. For example, we had a respondent who said that race was a key reason for conflicts with a neighbor, but they also expressed concerns about increases of such acts due to tension related to the 2024 election season. Respondents were asked how to recall or were asked to recall how they reacted during the hate act and to share how that hate act made them feel. We saw respondents spoke about being surprised, confused, and hurt, as well as feeling scared and unsafe. A few respondents expressed irritation, indignation, and anger, and several respondents, particularly in situations with strangers, noted they tried to de-escalate the situation. Respondents discussed longer-term impacts of the hate acts and their experiences with obtaining resources and support afterwards. They described physical and mental health care, protection and legal needs, work and school support. They also shared changes in behavior, changes in feelings about self or others, and any changes in routine that occurred after the hate act. And finally, respondents discussed coping strategies used to deal with the hate acts. Today, I'll share themes and quotes specific to these areas that are highlighted, and also talk through reporting the hate acts and costs related to them. Respondents were asked if they received physical and or mental health care after the act, or if they encountered any barriers in trying to obtain these resources. We saw some respondents had physical and mental health conditions resulting from the act, including anxiety and difficulty focusing, as seen from this respondent and their quotation. Other respondents had exacerbation of existing physical and mental health conditions. Here we can see one respondent had PTSD before the act and had recurring PTSD episodes triggered by the hate act after it happened. We also saw many respondents spoke of ongoing mental health impacts, saying it took them months to not regularly think about it. We did have some respondents thought they didn't need support. One respondent said they can't change what others think, so how can mental health support help them? Time as a deterrent in seeking physical and mental health support emerged as a theme as well. One respondent here, they declined medical care after a physical attack because she was late in picking up her kids. We also saw stigma and lack of culturally appropriate care as barriers to some respondents seeking mental health support. Next, respondents were asked about changes in their behaviors and in feelings about themselves or others after the act. We saw multiple respondents felt that after the act, they could no longer rely on others to help. One respondent here felt the experience made them realize not everyone wants the best for others. Many respondents, they also spoke about how after the act they became more alert or cautious. They had this heightened awareness in public, where one respondent here spoke about feeling less safe and having to keep their guard up. Several respondents expressed that they became more distrustful of people after the Hate Act. One person said the act changed their perspective on trying to trust people. They're hypervigilant on their general awareness of others, and they're hesitant to trust new people. Some respondents questioned how a hate act could happen to them, or they didn't understand where the hate was coming from. We also saw some respondents felt that their self-confidence and self-esteem declined after the act. One respondent here, who was targeted by a customer at their workplace, felt less confident in the work they were doing after the Hate Act. Many respondents were determined not to let the Hate Act impact them, not only themselves, but with friends and family. You can see this respondent here spoke about wanting to push it away, not having this infect their world. Next, respondents were asked whether or not they made changes to their routine after the Hate Act. We saw some respondents stopped going to the location where the act happened. One respondent, who was called a racial slur in a grocery store, stopped going to that store altogether and opted to drive 30 miles out of their way to go to a different grocery store. Others focused on becoming invisible and increasing their anonymity in public. We see this respondent here talked about wanting to blend in and really be invisible. We also saw a few respondents discussed disengaging in online activities to avoid cyberbullying. Um, this included blocking others in online platforms and stopping posting altogether on social media. Respondents discussed coping strategies they use. Some respondents saw hate speech and hate acts as part of everyday life. A few even have encountered so many hate acts on a daily basis and across their lives that it is not out of the ordinary to them. Many respondents found support and comfort in speaking to their family and friends about the Hate Act as well. You can see here multiple respondents talked about being able to speak to family and friends. It's therapeutic. They were able to vent, and others were able to take more of a lighthearted discussion approach with family and friends as well. Some respondents described how they attempted to overcome the Hate Act. For example, this respondent here, they described standing up to the offender and not letting the offender cut them in line. Other respondents sought to spread awareness about hate acts and research to learn more about hate acts and how to prevent them in the future. And lastly, some respondents struggled or were still struggling to cope with the Hate Act at the time of the interview. A few respondents commented that the interview itself showed them that they're still trying to cope with the Hate Act and may need to seek support. Next, respondents were asked about monetary costs incurred due to the Hate Act. There were questions about direct costs relating to property damage, costs for physical mental health appointments and medications, as well as indirect costs around protection, activities and devices, and lost wages from work. In asking questions specific to monetary costs, we did have many respondents speak about impacts or non-monetary costs of the Hate Act as well. Going back to the monetary costs, we had 17 respondents who reported a direct or indirect monetary costs associated with the impact of the Hate Act. You can see that here the costs cited totaled over $31,000, with direct costs totaling over $4,000 and indirect totaling over $27,000. Costs ranged from $4 to $14,000 per person, with a median cost of $525. Looking at themes related to monetary costs, we saw some individuals were willing to spend more money to avoid where the act occurred. For example, we have one respondent here who was using more expensive online grocery shopping and delivery services rather than going in person to the grocery store where the act had occurred. We had a few respondents consider the financial cost of lost wages from time taken off due to the Hate Act. One person had to stop working for 5 weeks, and they were able to detail out the costs of their lost wages over that time frame. Now let's take a look at themes related to non-monetary costs. Again, this discussion started by asking respondents about financial costs incurred due to the Hate Act, and many spoke about non-monetary costs as well. Some respondents considered time spent thinking about the act itself as a cost, often weeks and months after the act occurred. Some respondents who shared their experience with loved ones, they spoke about the emotional burden that their loved ones now face or would face if they shared the experience with them. One respondent here spoke about not wanting to share the acts with their family because they thought it would be too stressful for them. We also saw some respondents who told others about their experience and noted how it led to changes in their relationships with family, friends, or others. And in this case, we can see changes in relationships with losses of friends or coworkers here. Respondents were then asked about reporting the Hate Act if they had done so to authorities or other specific organizations or websites. We saw 36 respondents reported hate acts to the police or other entities. 16 of those called or contacted the police. The remaining reported hate acts to authorities, usually where the hate act occurred. For instance, if it was a workplace hate act, they would report the incident to managers or human resources. Of those that reported the hate acts, many were dissatisfied with the response received. And for those that did not report the act, they mentioned that this was because they didn't feel the act rose to the threshold to report it. They were uncomfortable reporting it, or they were unsure how to go about reporting it. So again, looking at themes, we know attitude about reporting were mixed, but many reported dissatisfaction with reporting the outcome, whether to police authorities or other authorities. We saw some respondents experienced work-related hate acts, said reporting things to their managers actually made things worse for them at work. And then we did have one respondent who experienced a physical attack. They were satisfied with how the police responded, mentioning they received a card with counseling resources for victims of hate that was appreciated, although not used. Many respondents chose not to report the hate act to police. Some felt the act did not reach a reporting threshold, and others felt that unless they were physically assaulted or there was a crime, the police would not do anything. So, tying this together, again, we saw how the social and political context was an important factor in how respondents thought about hate and why it occurs. We saw that hate acts, again, both hate crimes and non-criminal hate incidents, can have ongoing impacts for respondents. Many respondents described not only monetary but non-monetary costs incurred due to the Hate Act, and that numerous coping strategies were used, some continue to be used to deal with the impacts of hate acts. And respondents had expressed uncertainty as to whether and how to report an act to authorities. So with that, thank you to the full team who worked on this project, and thanks again to our interview respondents for sharing their experiences with our team. With that, I'll turn it back to Tiffany for Q&A.
Thank you so much, Valerie, and thank you, Alex and Todd, for a wonderful presentation. I see some of the questions have been answered in the Q&A, so I'm just going to read a couple of those aloud in case folks aren't able to see them, but please use the Q&A function in Zoom to ask questions. We have about 20 minutes for Q&A. Alex, can you share what sort of mental health support that Californians who experience hate are looking for?
Yeah, I mean, so this just didn't actually measure that specifically. We simply asked respondents whether they had received or needed counseling and therapy or other type of mental health support. So we can't really capture what kind of support that victims of hate are looking for. But I think that's where some of this qualitative stuff can come in and supplement the quantitative data. So hopefully there's more of that as well.
Valerie, is there anything else you want to add about that with the qualitative report on the types of mental health support folks were looking for?
Yeah, I know with some of the respondents we spoke to, the types of supports they were looking for included anything from seeking counselors and potentially being able to go to therapy to be able to talk through some of their concerns. We did have some respondents who were already currently receiving mental health support and able to talk through some of these events with their psychologists that they were already seeing.
Thank you. Somebody asked how many interviews were reviewed in the qualitative analysis. I think you had that number on one
That,
of the slides.
yep, that 53.
53. Thank you. What does the support of protection mean within the context of support received after a hate act?
Yeah, so we can't really expand on that too much. We simply asked respondents, did they receive protection for themselves or their family's physical safety? And that's really all we can really capture through the survey, and that's what we had.
Thank you. Somebody asked if there were any qualitative data about why the Asian American, Native Hawaiian, and Pacific Islander and Middle Eastern populations were significantly less likely to access mental health support following hate incidents.
Yeah, I can speak to that. Um, we didn't necessarily look at the quantitative aspects of the qualitative data by race, ethnicity to see what support was accessed or not. So I can speak more anecdotally about the respondents in this work and I would say in general we had some individuals who did receive mental health support and others who didn't. I know in some of the themes we raised about individuals who did not seek support, we mentioned this kind of theme of family stigma or support, and I believe one of our respondents, had mentioned that and felt that there was family stigma in not reaching out to obtain mental health support for this experience of the hate act because again they felt that the family stigma really made it so reaching out wasn't you know supported by family.
Mm-hmm. So I think we kind of went over the definitions of unmet mental health need. I know there's some complicated concepts there. Can you talk a little bit more about what's included in multiple unmet support needs and if there were any themes?
Yeah, so for at least the quantitative side of things, a respondent was quoted as having multiple unmet needs if they had selected two or more of any of the types of unmet need or needs that they needed. That was measured on GIST. For example, if they needed counseling in addition to medical care, if they needed time off from work in addition to financial assistance, anything that was more than two was counted as multiple unmet needs. In terms of themes, I think maybe the qualitative side of things can capture that better. Quantitatively, it was just a checkbox, all that applies. So narratively, we can't really say too much from the quantitative side of things.
Valerie, is there anything you want to add to that?
Yeah, I would just say we didn't look at the data from the aspect of multiple unmet support needs. Um, just looked at it again through kind of our long-term impact focus areas. So no specific themes related to this multiple unmet support needs.
Thank you. Can you share any information about the geographic breakdown for the qualitative interviews?
We don't have that detailed information. The all interviews were from Californians, so it is specific to the state, but we didn't break down or look at the geographic breakdown of those 53 interviewees.
Thank you. Someone says the most recent FBI reporting data shows a decrease in reported hate crimes from 2023 to 2024. Based on your experience with CHIS data on hate acts and the qualitative data you obtained, why do you think this might be? More generally, what did you find prevented people from reporting aside from family stigma?
I guess I
I,
can.
I
Oh, go ahead.
Oh, I was going to say, I can just share some thoughts from our respondents. Again, the 53 individuals shared their experiences with reporting, whether they reported it or not, and what barriers they experienced. So we did see that there were a lot of respondents that were unsure what the process even looked like to report a hate act, whether that's to police or other authorities. We One of the things we didn't share here, but is in the report, was this kind of wish list of resources that could be helpful for individuals, either for themselves or for others in the future that experience hate acts. And so we did hear, the wanting to be able to know, what are the steps to reporting hate acts? How can we do that? And just heard barriers too that I did share in terms of many respondents felt that the act itself didn't necessarily rise to the threshold for reporting, thinking that more physical attacks were ones that they wanted the law enforcement to focus on, and that they considered something that would be the level to then report.
Yeah, I don't think I have too much more to add. I would just say that declines in reporting to formal authorities does not equate decline in hate acts experienced. We see through our CHIS data that hate acts are pervasive, but actually engaging in police or formal agencies after experiencing hate is actually quite low. So I think that's like the main crux here. So like you could be seeing very easily a decline in reported hate crimes, but that actually at the population level experiences, they may be stable or actually increasing.
Thank you for that information. I do really encourage folks to read the qualitative study. It's a 60-page in-depth study with really powerful testimonials from folks. I'm going to redrop those links in the chat, but you can also scan the QR code that's on your screen. How are you hoping policymakers or the public use the data in these reports?
Yeah, so I'm not sure. The data that we provide really shows that there's a burden of hate is concentrated in specific populations that have been historically burdened by hate in the past. And it really shows where kind of systems are failing. So we really want policymakers to be able to look at this data to better allocate resources to populations, to try to evaluate new kind of strategies to prevent hate and to provide resources to these populations that are just overburdened by hate on a yearly basis, on a daily basis. These findings really show that the mental health support, legal assistance, the reporting pathways that are available aren't reaching the people who experience hate the most often currently. So we just need kind of a paradigm shift to try to better reach these populations and communities.
Thank you, Alex. Valerie, I see you're nodding. Is there anything else you want to add?
Nothing to add. That was wonderful.
I agree. Did you learn anything from interviewees about normalization of hate or discrimination?
Absolutely. Yeah, this was one of our major themes and emerging codes that came from this study, was that many of our respondents, this falls under kind of our coping section, really did normalize hate acts. We have take a look at the full report, you'll see many more quotations as well of people speaking about how these types of acts are uh, kind of an ongoing part of many people's lives regularly, some even daily. And so this was absolutely one of the themes that we saw with our interviewees, how so many respondents really normalize these types of hate acts in their lives.
Thank you. Someone says, thank you for sharing the insightful data and policy recommendations. How did you recruit survey respondents and interview participants? Did you face any difficulties when interviewing victims of hate due to the severity of their experiences?
Yeah, so we were able to recruit survey respondents for the individuals that did take the CHIS adult questionnaire and responded yes to experiencing a hate act in the last 12 months. So we're able to reach out to these individuals and set up interviews with them. We did have protocols in place to conduct these interviews. We had trainings with our interview teams as well, knowing that individuals we spoke to experienced a hate act, and this can be a hard topic to discuss. And so we had a lot of mental health support services and resources available and provided this to all of our interviewees.
Thank you. We're getting some really great questions about the qualitative study. What themes, if any, of factors that helped folks remain resilient in the face of hate emerge?
That's a great question. We did see this. This was one of our themes as well, just being able to not let the hate incident, the hate act impact them. And we saw a lot of different takes around this in terms of what respondents were doing, how to either compartmentalize things or be able to share the act and talk with friends and family, coworkers in a way to provide awareness, but then also be able to receive support within their social network as well. So a lot of helpful information that they themselves shared with us and that we then tried to convey in this report as well, specifically around that theme about overcoming the hate act and not letting it impact them.
Absolutely. What would be an upstream approach to stopping hate from happening altogether and stopping normalization of hate acts in our state versus resources for support?
So, I mean, I think that's a really great question. It's a really complex question that, at CHIS, we collect the data, we come up with the findings. We want the data to inform and be available to policymakers to use. I think the data shows that a lot of the communities that have been historically that are burdened by hate continue to be burdened by hate. So really, some of it is kind of a structural, social policy level, reducing the consequences of hate, shifting what's considered acceptable. But really, we're not policymakers here. We're just trying to put the data out there for everyone to use. So I'm not really sure what an amazing or great upstream policy might be that would be effective. But there definitely needs to be additional research in that, yeah.
Absolutely. And if it's something that folks want to discuss, you can always reach out to us. Our email is healthpolicy@ucla.edu. We're happy to work with you, provide data, and connect. Were you able to interview newly arrived immigrants, undocumented individuals, or refugees? How do you control for individuals who may be more comfortable sharing their experiences to researchers versus individuals who are stigmatized? Often, people who can share their experiences, call law enforcement, or get help are those who may not be most vulnerable. Curious what you all did in qualitative research here.
Yeah, we were very focused on making sure individuals felt comfortable sharing their experiences. And so, again, we had a lot of kind of training and coaching with our interview team themselves to be able to conduct these interviews with respondents, being very respectful of them. We had a whole IRB protocol in place, making sure we were taking precautions and protecting those that participated in this research. And that includes, what we do with the data, how we use it, how we share it, how we store it. And we're very upfront and told all respondents how we're going to protect this information for them. I know you had mentioned, specifically, did we reach out? Did we seek out individuals that are immigrants or refugees? That was definitely a priority, but not necessarily something we tracked or asked about. One of the things we did ask about, of course, was bias motivation. And so we had respondents share, they felt it could be because of race or their ancestry, and immigration as well.
Thank you. The respondents' response about trying to be more invisible. Do you feel that immigration status coupled with the political climate influences their hesitancy to seek help? And how many of the respondents experienced adverse childhood experiences and due to long-term exposure to childhood adverse experiences has influenced their behavior and acceptance of hate acts as an adult?
Great questions. We did not specifically ask about ACEs, so we don't have that detailed level of information, but I think it's absolutely interesting and informative to learn about that and explore it further. Um, in terms of trying to be invisible, we did have a lot of respondents uh, experience hate acts that were motivated by race, ethnicity, origin. And many spoke about, again, that kind of the political climate and the influence of that on their concern about the hate act, reaching out to others, etc. The trying to be invisible piece, there were definitely some respondents who um, felt that, but others who talked about being invisible just in their daily lives as well. S- yes, I think I answered that.
Yes. Um, Alex, is there anything you want to add about ACEs? I can see some conversation already
Yeah, I
starting
mean,
about potential research.
yeah, I think that's a really great question. And, we haven't looked at that in quantitatively in the data, but I think that's definitely something we could explore further.
Definitely. And if folks are doing it, and you do have some findings that you want to share, again, you can always reach out to us. We love hearing from you. Is there any indication that the fact that women were more likely to experience the hate incidents are related to sexualized harassment that intersects with racialized violence?
So I can speak for maybe from the quantitative side of things. So just can't directly test whether a woman's higher rates of experiencing hate are driven by sexualized harassment that intersect with racialized violence because the survey just doesn't collect that granular level detail. We can say that, women had a significantly higher prevalence of unmet needs, and they were more likely to receive mental health support. And these trends really are consistent with exposure to more persistent, personal, and possibly intrusive forms of hate, which is really how sexualized harassment often appears in like population level data that we see.
Thank you, Alex. So I want to just bring us back to a question that was asked at the beginning that was already answered just to close this out because we have about a minute left. Do you have any plans to do future research and analysis on this topic? Is just continuing to collect information about hate incidents, Alex?
Yeah, so there will be an additional policy brief released early next year, and that's going to look at how experiences of hate varied across different regions and sociodemographic characteristics. And we also, the 2025 CHIS captured data related to hate acts, and it was also the second year that asked about the frequency of hate experiences, as well as the supports received or not received. So that additional data we could pull with the 2024 data to provide more reliable and stable estimates. And as Todd just put in, that the hate incident questions will also continue in the 2026 CHIS.
Thank you. Unfortunately, that's all the time we have. Just a reminder, we will be posting the recording of this event on our YouTube page with closed captions in the next 2 weeks. If you would like a copy of today's presentation, email us at healthpolicy@ucla.edu. I just want to also thank you for attending our last webinar of the year and for your support of CHIS and the UCLA Center for Health Policy Research. Have a great holiday season, and we'll see you in 2026.